Welcome to the Global Health Equity Miniseries. I'm your host, Harvey Kennedy Pitt. Join us as we look at 8 public health principles that can help health systems build capacity through adaptation. So, good afternoon, Giovanni. It's so good to have you on Series 2 of the Global Health Equity Miniseries. I guess we can begin by you introducing yourself.
My name is Dr. Giovanni. I'm a neuro-disability physiotherapist. By background, I'm a patient advocate, and I am founder of PROBr, which is a digital research platform that makes it easier for anyone, even you guys watching, to join on research studies, which contribute to the impact of healthcare.
Where are you sort of based at the moment, geographically?
Yeah, so geographically, I'm based everywhere. So I am originally from the US. I was born in a Haitian heritage background. So I am Haitian by background. And after I completed my bachelor's degree in Miami, I moved to Scotland, pursued my master's, did my doctorate, and worked as a physiotherapist. So I'm working all over the place, mainly to pursue PROBr, our research platform, to kind of make it more of a international staple into the research world.
And I guess it would be good to sort of understand who you kind of work with, who are your typical clients, who are the communities that or stakeholders that you're working with.
So at the moment, we are working with an array of partners. Right now, we just got a big partnership with the NIHR, HRC, Accelerated Surgical Care. I know it's a big mouthful.
Yeah, and what is that? Tell us a bit about what that kind of is for those who might not know.
Yes. So with this specific domain of the NIHR, they focus on helping entrepreneurs create sort of innovations that's related to surgery. So their main principle is really finding innovations that help with making surgery less invasive, also helping with post-operative care. So after you get surgery, what would happen, like how would your healing time be impacted, and also creating other innovations that just make the whole process, like patient outcomes, a lot easier. So this partnership is one of our biggest ones, mainly because we're helping anyone who wants to join on these innovations. So if you want to test a new product as a participant, you can do that. So you get to try out pioneering innovations. And also as a researcher, you get to go onto our platform and find those participants who are keen to test out these new innovations or whatever they have. So one of your principles that aligns with ours is autonomy as well. So with autonomy on our platform, that's really one of the biggest things that makes it really attractive to especially participants and patients, because a lot of the time they may feel like they don't have a voice or they don't have a decision to make. But on our platform, you can go on and look at different research studies that you want to join, and you get to decide which one you want to make an impact in. And whatever one you pick, you really have that voice to. Once you sign up, you can decide if you want to opt out. You can also decide if you want to continue staying in, and you have that really bubble to where you have a lot of information of what's going on and what is going to be the future of healthcare.
Amazing. Yeah, that's one of the most sort of central principles, I would say, of the 8 that we chose to highlight in our work. Autonomy, people being able to do things themselves as opposed to being stuck in that sort of historical loop of returning to help, ending up in a crisis, returning to help, but really needing to do that less. It creates less of a strain on health systems, just like the NHS, and it really empowers people to take control of their decision making as it relates to their health. What key sort of problem would you say that you're trying to solve through the work you're doing?
Our biggest mission really is to close the gap with the health equity space. So I know a lot of people talk about health equality and making sure that we all are on the same playing field, but all of us being on the same playing field isn't a starting point for everybody, especially because of how we had to overcome a lot of racial systemic issues within the healthcare system, and we're still overcoming that now in 2025. So when it comes to this platform, I mean, research study is really the genesis, or it's the origin of innovation. It's the origin of finding new drugs, finding new treatments, finding new healthcare policies or better healthcare policies. So being able to test out these things, creating focus groups for people where people give their opinions, we get it from the actual source, like the actual people. That helps us to shape and make healthcare a lot better for people and improving health patient outcomes. So yeah, it's really that health equity. That's really where our focus is, and that's where we kind of go back to when we're thinking, how do we help make things better? And we think health equity. So that gives us that basis.
But as you know, through kind of Unstuck, we look at quite a bit of the sort of the principles of how things are um, uh, designed, how we engage, and things like autonomy or efficiency,
Mhm.
participation, even sustainability, extends to that as well. I guess if you've had a chance to look at some of our principles, what would you say are some of the key principles that you operate from when you're operating PROBr?
Well, one of your principles was which is equity. That's that aligns with ours. So I really did like that when I saw Unstuck, and obviously being a part of you being part of the global health environment. I do think that there are those synergies there. I think health equity. I mean, that's going to be something that I'm going to say till I'm blue in the face. And I think what you guys are doing to help combat that as well aligns with our principles.
I don't think it can be really interesting to be in the practice space, particularly when you've completed sort of the level of study that you've completed. I think there's an assumption that you'll go into academia, you'll go into an academic institution, and you kind of just talk about what you know for the remainder of your career. But you seem really practice focused, like you want to actually do something. You want to work with people, you want to work with health systems, you want to strengthen those systems, and you want to create a tangible or measurable difference. Would you say that that's resonating with
Yeah.
you?
I mean, as soon as you said it, like I get excited about getting active and actually getting into the nitty gritty. Like that is me through and through. I do love academia and I do want to get into it. I'm looking into PhD programs for like neurological things like unrelated to physiotherapy. But I think with me, I do like to work hand in hand with people, working next to people, and just talking to people about like what their issues are and making that direct impact. I think a lot of times we do have a lot of people who give their thoughts, their think piece, and think pieces are great because it gives us a level of information of what we need to work with. But I think we need to have the same amount of think pieces that we have. We should have the same amount of actual execution,
Absolutely.
just so that we can actually have some sort of outcome that we're striving for.
Yeah, lots of thinking, lots of planning, lots of talking about thinking and planning, but oftentimes fails to sort of reach action. And that can be as a result of resourcing, that can be a result of a lack of sort of vision or
Mm-hmm.
strategy to get from point A to point maybe C, and that's I think where consultants like yourself or entrepreneurs like yourself, like those that we work with in the spaces that we're in, really have the power to make a difference. And it's about being able to be dedicated to strategies and or to thinking sort of about the big picture or the long game.
Yeah,
Yeah,
exactly. And you brought up a good point. A lot of the think pieces, it comes from the lack of resources. So the only thing people can do, I mean, your thought is free, right?
yeah.
But when it comes to planning, that can take time, which many people may not have, or even money, like currency, things like that, where people they would love to do it, but they just don't have that. And I think that's another discussion. But that just goes to show that there are so many issues, but there's not enough money to go around to address that.
Yeah, and that can be really a difficult part of working with multilateral or multi-level stakeholders is trying to help everyone understand that and that to ensure that we're being realistic and we're being pragmatic in what we're trying to do. So that's a really important point. As a call to action, I know that those who will be watching this will be potentially from any background. They could even be from non-health backgrounds, really trying to understand equity or how it's operating within the entrepreneurial space or the business space or the health space. What would that call to action be to those people, do you think, to get them really thinking and ensure they take something really valuable away from today's chat?
I would say that your I'm gonna need some time for that. I would say a call to action in general would be to do what you think or hmm. So make an impact in the world the way that you think fits. So making sure that like making sure that you're doing enough research, obviously, and making sure that your opinion is heard, your voice is heard. I think oftentimes it is very easy to get caught up in other people's opinions and following that, but just remember that you are your own person and you have the autonomy and you have your opinion, your voice matters. And if you do believe in something and it truly contributes to the greater good of the world, then you should definitely make that voice known and just to never give up. As cliche as that sounds, I mean, never giving up has brought me to this point. I mean, with my background and just like a lot of things that were against me, and also the racial and systemic things that are still against me, not giving up has brought me to this point where I'm able to speak on bigger platforms and also speak with people like you who want to know more about what we're doing and how to help with that.
Absolutely. And I love the word autonomy. It's one of our principles as well. And I
Mhm.
think that you're demonstrating that yourself. You're taking absolute control of how you create impact in the spaces that you're in. You're encouraging others to do the same, both those who have the professional, I guess, acumen and background, but also those who have lived experience, those with what we'd call community wisdom. That's how you get community wisdom, is sort of asking people what they're needing and then translating that into the work that you're doing. I think that people would want to know more about what you're doing, and I would hate for them not to know how to get in contact with you. So, what is the best way that people can sort of follow the work of PROBr and kind of learn more about what you're doing, how you're creating impact?
Yeah, so the easiest way to get involved and be part of the PROBr community, which the PROBr community is a learning community where you learn so many things about health equity, you learn about diversity, you learn about just impact in healthcare. You can go onto the PROBr website. So it's PROBR.co, so PROBr.co. Or if you have an Instagram, it's at PROBr, so at PROBR. Any one of them, it'll lead you to being immersed into the community and being part of just, the greater good of society.
Really, really good. I'm actually going to take a little pause there because I want to dive back into something that you said really, really briefly. And it
Yeah.
was it was really around what was that thing that you were just talking about? You was something specific and I want to go back to it. Um,
Well, from which question? I can.
So you were talking about the work that you do, the call to action, doing, being where you are, how you get into the PROBr community. Um, I think probably the PROBr community, I think is what it really is. How do people join that community? What's the value of being
Yeah.
in that space? Okay, so I'll just do that.
Okay.
So I'm aware that you have sort of a proper community. I think it's on Facebook. It's also there's a LinkedIn element of that as well. And I'm in that space, and I've been watching sort of the conversations happen. I haven't engaged just yet, but I am watching it unfold. And but I think it's a really valuable space, particularly for those who are sort of game changers or the change makers. They want to see something and do something different than
Yeah.
just being, what is this space and how can people, who is that space for and how can they get involved in that space?
Yeah, thanks for bringing that up, actually. So we have a Facebook group and we have two different kinds. We have one for US people and UK people. The reason why we divided it is just so that a lot of the policies are more specific in that group and it doesn't get confusing. So with the Facebook group, it's facebook.com/groups/ PROBr Community UK. I'm sure you'll put it on this space anyways. So the group is called the Empowered Ethnic Health Group, and it's really to bring together anyone from all groups. I mean, it's not to exclude anyone who's not ethnic like an ethnic minority, but just really for those who are ethnic minorities who have trouble with the system and they need to be in a community where people have shared and lived experiences within the healthcare system. So, for example, if you went to the doctor and they were dismissing your concerns or your pain, you go into the group and you share that. And we have group experts like myself, like you, who's involved in the group, and other people like from nursing background, doctor background, and they give advice. They don't tell you exactly what you need to do, but they point you in the right direction, such as giving you like resources from the NHS or the government to help you navigate through difficult times. So that way you're advocating for yourself and it helps you to build that confidence. And that's why the element of the empowered part,
Yeah.
that's where we emphasize a lot. And that group is open to anyone. And it's really for you to just join in and create a big friendship and a community with everyone in it.
That is absolutely phenomenal. And, I think as many things as we see on the internet these days, everything's on social media. It just seems like you're scrolling and it's just endless amounts of information. It was quite refreshing to come across your platform. And it's fantastic to see the work that you're doing to bring sort of experts and also patients or those who have experiences of healthcare into the same space to just have the conversations that they need to have. So that's been really valuable. Well, It's been an absolute pleasure speaking to you this afternoon, and I hope that people will get in contact and get to follow your work and learn more. We could literally talk all day about this because we're obviously both very, very passionate about the topic.
Yeah.
What I want to try and drive is people showing an interest in your work and trying to learn more about it, engaging with it, and also spreading the word.
Thank you so much, Harvey. This was amazing. Thank you for bringing me on to this and spreading awareness about just improving healthcare outcomes in general, especially for underserved communities.